right, thanks guys. See you in a bit. Well, first at 5:30, they're supposed to last up to 20 years.
But they're failing at an alarming rate. A popular type of hip implant is giving some patients and doctors fits. The most recent statistics from the American Academy of Orthopedic Surgeons show nearly 280,000 patients have total hip replacement surgery. However, the failure rate is 10%. And as Jim Mendoza explains, one of the big problems is with what's called metal-on-metal implants, Jim?
That's right, Steph. Doctors say the problem is in many cases the device breaks down too fast and it has the potential to do a lot of damage to the patient.
Jonathan Molina's rehab routine consists of swimming laps in his grandfather's backyard pool.
In the water, you're weightless, so there's not so much pressure, on your leg when you're exercising.
Exercise strengthens the muscles around his hips. 4 years ago, the house painter needed a total hip replacement. Metal-on-metal implants were used.
They said as long as I kind of, take it easy, be careful what I'm doing and whatnot, that, hey, it could last me a lifetime.
This is what a metal-on-metal hip device looks like. All hip implants shed particles because of wear and tear, but metal shavings are smaller.
But those particles can get into the bloodstream. They can get in your liver, they can get into your brain, they can get into other organs, and they can cause almost a reaction.
2 months after his metal hip replacement, Jonathan says he was in worse shape than before the surgery.
The pain was intense through the back, even in the groin, straight down to my knee. It caused my knee to get sore. So it was basically this whole side right there. Not even the pain medication would work sometimes. It was just incredible.
Orthopedic surgeon Linda Rasmussen says many metal-on-metal implants are failing and must be replaced with devices made of plastic or ceramic. She says some patients who have had metal-on-metal implants won't have a problem, but others will.
For those that are having pain, that are having problems, you need to see your doctor and make sure that there's nothing going on.
Jonathan had the metal implants removed and replaced with another material.
The prosthetic itself feels a lot better. There is still some pain, but I think it's more for me healing now more than anything. It doesn't really feel the same as it did when I had the metal in there.
The second surgery was done in August. He still walks with a limp. That's a lot better than barely being able to walk at all.
Published reports say so far this year, the Food and Drug Administration has received nearly 11,000 complaints about metal-on-metal hip devices. Jim Mendoza, Hawaii News Now.
All right, thank you much, Jim.